Well, hello and welcome. My name is Marcia Levy. I am a trustee of the BEARR Trust and a lawyer by profession. This is the third webinar in our series, and today we look at civil society organizations and innovation in a time of pandemic. Many of you may know that in August and September of this year, we carried out a survey on the effects of COVID-19 and the steps taken to combat it on the work of civil society organizations in Eastern Europe, Central Asia, and the Caucasus. We were delighted that over 300 CSOs took part and told us about their challenges and the changes they made in their practice to meet them. In fact, these three webinars have been a new development for the BEARR Trust, our own innovation at this time. And today we want to focus on those changes that we've had to make by sharing experiences and best practice. We had hoped to have 4 speakers today, but unfortunately, Kurbongul Kosimova of Najoti-Kudakon in Tajikistan is unable to join us because of problems with the power supply. But she has sent us a presentation and photographs which I will introduce. So our 3 speakers today are Kristina Spirina of Winds of Changes in Odessa, Ukraine, Anastasiia Stytsenko of Youth Volunteer Organization Leadership in Karakol, Kyrgyzstan, and Birodar Mirzaev from the Center for the Support of Civic Initiatives in Fergana in Uzbekistan. I will introduce each speaker in a little more detail in turn before they speak. And if they agree, after this webinar, we will post their presentations on our website. Each speaker will speak for about 10 minutes, leaving 30 or 40 minutes for a wider discussion. They will all speak in Russian, and we're very fortunate to have with us Irina Inocentseva, who will provide simultaneous interpretation. All the audience will be muted, but if you would like to ask a question or make a contribution, you can use the chat box to send the question or use the blue hand sign or raise your own hand. We are going to record the webinar so that people who haven't been able to join us today can watch it later. And that recording will be made available on our website. So if you don't want to be seen, please switch off your camera. I'm now going to ask Nicola Ramsden, the chair of the BEARR Trust, to say a few words.
Thank you, Marcia. Hello and good afternoon, everybody, and welcome to the third and final of our series of webinars that replaces our usual November annual conference. Over the last 2 weeks, we have looked at the impact of the pandemic on groups helping people with disabilities and migrants. And today's session will pull a lot of those threads together with an examination of innovation and how civil society organizations have adapted. If you missed the first 2 webinars or would like to see them again, they will be on the BEARR website. I'd like to say a big thank you to everybody who has donated to BEARR over the course of these webinars. These contributions are very valuable indeed to us. Thank you very much. Money we raise goes towards our small grants scheme, which many of you are familiar with. And in fact, 3 of the organizations speaking today are in fact recipients of BEARR grants in the past. You might like to know that we will soon be announcing our small grant scheme for 2021. And this will be picking up on some of the themes that emerged from the survey that Marcia mentioned, in particular, the very difficult issue of isolation that has emerged during this pandemic. So look out for the announcement of that within the next few weeks. So many thanks. I think we're due to have a very interesting session. And I'll now pass you back to Louisa and Marcia.
Well, now let's turn to the speakers. Our first speaker is Kristina Spirina from Winds of Changes in Odessa, Ukraine. This charity's aim is to help every woman and girl, regardless of age, race, or religion, to take control of their lives and improve the quality of their lives through programs designed to educate them about their rights and health and employment. So, Kristina.
Good afternoon, ladies and gentlemen. I'm Kristina. I will tell you briefly about our fund. Charity Fund Winds of Changes is a platform of women's initiative, and it was launched back in 2018. Our first project was implemented in 2019, thanks to BEARR Trust support. BEARR Trust was the first institution to believe in us and to give us a very good push at the very beginning. In 2020, we implemented two projects related to overcoming some obstacles related to the COVID pandemic. The first was supported by Pact Ukraine. During that project, we developed an map for Roma women, for them to be able to get better access to social services in Odessa region, such services as healthcare, education, and restoring their IDs, as well as psychological counseling. Many Roman women are illiterate, unfortunately, and they face difficulties understanding who to apply to when they need certain services. That's why we developed this map. You might see it. It's a quest map with the list of the useful contacts and with illustrations that they can actually see step by step the procedure of applying for such services. And I'm very glad that they are using it actively. We also conducted consultations with the medical personnel, and we invited medical personnel to talk online with our potential beneficiaries. We distributed some PPE, and we contracted a private clinic that would cater to Roma women. Most of them are mothers of many children, and they get medical examination, including gynecological examination. Thanks to our partners, we have managed to distribute leaflets with instructions, with illustrations on how to take care in the pandemic times. So these are the leaflets that we distributed very broadly amongst Roma communities. We hold self-assistance groups. We've got a lot of wonderful successes, and I can share a lot with you. I am proud that we have introduce certain changes into the lives of our beneficiaries. I know that they do not live a very easy life, but thanks to participating in the projects, they feel more empowered to address their own challenges. Roma women are very introverted, and sometimes they would not seek assistance, but when our psychologists work with them, when we bring them together in online groups, encourage them to share their interests, their ideas, their practices, they feel more easygoing, they feel better prepared to share their challenges so that we could identify those challenges and offer support. The second project was called Women in the Digital Era. We had 3 online courses, one on the English language for Roma women. There were 50 participants of the program. We also had a separate course on critical thinking and on IT design. The major aim of that project was for the women who lost their jobs during the pandemic could find alternative ways to earn their living, to make sure that they develop new skills. We decided to train them in how to do IT templates of leaflets, of business cards, of brochures, etc. So now there are a lot of companies that would be using those services to have their materials printed. And it is a fairly relevant skill, and I believe that the project was successful. Many of our trainees have got their contracts. At first, we helped them with finding potential clients so that they could be interns and do some of the orders as interns. And now they can earn their living thanks to that. We train them in English because basic English is necessary when they work online. So for them to understand what the work is about when they do the layout of their templates, etc. So I would say that online courses were great fun for participants, for the trainees. It wasn't just lecturing, it was very interactive, it was engaging. The trainers used various materials, visuals, etc. So that was highly appreciated by the trainees. They discussed very serious topics. And in October, we launched the third pilot project supported by the International Renaissance Foundation. It is a program for vocational training and development of social entrepreneurship. Can we see the video, please? Thank you.
Здравствуйте, меня зовут Кристина Спирина. Благотворительный фонд «Ветра перемен», платформа женских инициатив «Украина, город Одесса». Хотим поблагодарить BEARR Trust за поддержку, за то, что впервые поверили в нас и дали нам старт для начала нашей деятельности и работы нашего благотворительного фонда. За 1,5 года мы реализовали уже 5 проектов помощи женщин уязвимым группам. Наиболее актуальная помощь стала в период пандемии, когда женщины начали терять рабочие места и остались без работы. В этот период им наша поддержка была просто необходима. Сейчас мы реализовываем проект «Наше социальное предпринимательство», где мы обучаем девочек швейному мастерству. После окончания курсов, получения определенных навыков, девочки смогут начинать работать, где мы будем способствовать трудоустройству, и они смогут содержать свои семьи, зарабатывать. Самых уязвимых групп сообщества – это ромские женщины, которые нуждаются в нашей помощи и поддержке. Хочу представить вам нашу лидерку, мобилизаторку Татьяну, женщина ромского сообщества, наша коллега.
Здравствуйте. У нас помощь для обучения и для работы для девочек ромской национальности, так как девчатам тяжело устроиться на работу, а тем более получить обучение. Мы им давали разного вида помощь, но стоит такой вопрос, чтобы они обучались и у них была возможность работать и обеспечить свою семью. Жаль, очень сложно в том, что у нас проект работает только до декабря месяца. То есть у девчонок не будет возможности и продолжить и обучение, и работу. Хотелось бы, чтобы женщины ромской национальности имели такую же возможность, как и все остальные, потому что дискриминация идет, и им очень сложно устроиться на работу. Мы отличаемся от других организаций тем, что у нас на первом плане стоит то, чтобы обучить и обеспечить работой ромских женщин, а не давать им только продукты, там вещи, разную помощь. Хотелось бы, чтобы они в жизни получили свою профессию и возможность жить, как все нормальные люди.
Обычно у ромских женщин много детей. И составляет трудность пойти получить новое образование, либо получить новые навыки, посетить курсы, либо трудоустроиться. Почему? Потому что не с кем оставить детей. Чтобы женщины посещали наши курсы и смогли ходить, и все-таки получили новые знания, мы оборудовали детскую комнату, чтобы женщины могли оставить деток, когда они обучаются. Мы рады, что BEARR Trust нас поддержал, и мы надеемся на дальнейшее сотрудничество. Спасибо огромное.
Что касается курсов, которые сейчас проходят.
Now, if I may comment on the course that is underway right now, we talk to these young women, we know their needs and challenges, and as I said before, placing in jobs is quite difficult. There are a lot of single mothers who cannot support their children, so they can't rely on anyone for help. So our major task there is to get them trained and help them with employment. It wasn't my wish to actually arrange this needlework shop. When we conducted a survey, most of the Roma women said that it is a skill that we find most useful. Hence, this workshop for needlework for the sewing. And when they see that they can cope with the task, that they can make good clothing or linen or whatever, they are very happy. And we want to continue this work so that we provide such assistance to women further. We had 20 trainees in this course, and some of them will work for some factories. Some will stay and act as trainers. I don't know what is in store for them in the future, but I hope that we gave them good impetus for their future development and life. And volunteers from Belarus are supporting us to develop a website for this course so that we can promote it even further, so that they could market their produce even through that website. So we do our best to provide them with support and to develop social entrepreneurship in our community. So we do not supply them with a certain humanitarian aid, but rather help them get integrated in the Ukrainian society, empower them through new skills and expertise, so that they feel they are equal with other members of the society. And Romos believe that when their women get some jobs outside their households, they become a role model for their peers and younger women. Women share their experiences, their successes. They share information about our fund. They share their experience of being in the peer groups, and they invite other women to join in. And they feel more open, more ready to be with us, and they start trusting us. So, when we work well, our beneficiaries feel it, they can become successful, and they can become leaders in their communities. We also trained several women in hairdressers activities, and this woman has been placed in the job, and now she comes to us together with her two daughters, and she is a role model, a motivator to other trainees of ours. Thank you very much. Thank you for your attention.
Thank you very much, Kristina. It was a very, very interesting presentation, and thank you also for the video, which was great to see. At this point, we were hoping that Kurbongul would be able to join us, but as I've said, she isn't able to. So I'm going to just briefly introduce the presentation, and Louisa is going to show the photographs that she sent us. Kurbongul Kosimova is the director of Najoti-Kudakon, which is a civil society organization which was established in Khulob, in a city in the Katlan region of southern Tajikistan, in 1993. This was during the Civil War, and it was started by women who had lost loved ones and wanted to support other women who found themselves in the same situation. Today, they provide a comprehensive service to women who are victims of domestic violence, often working through self-help groups and providing support in the forms of trauma counseling and also advice on setting up small businesses. This is what Kurbongul wrote. The Women's Resource Center continues to work during the second wave of COVID-19. We have adapted to the new conditions by ensuring the health and safety of our staff, by disinfecting the premises and providing protective clothing and medicines. We have reinforced consultation work by telephone. Our hotline is now linked to the Najoti-Kudakon lawyer's telephone, and it's open 24 hours a day. We have prepared food packages for female workers, and we're publishing information booklets. This has been made possible by the support of the Coalition Against Torture and Cruel Treatment and the Urgent Fund, showing once again that we can succeed only by cooperating and collaborating. For the past 26 years, Najoti-Kudakon has worked with communities in the remote mountainous area of Kulyab region. Today in Tajikistan, there are many national programs aimed at developing and improving the lives of people in our country and eliminating domestic violence, but these programs are in their early stages. We are currently carrying out information work. We take information about COVID-19 from a variety of different networks, translate it into the Tajik language, and drive to the communities in what we call our caravan of health to distribute the information. But this is not enough. For various reasons, limited access to information and inability to understand the full severity of the disease, we have also had to provide direct, targeted assistance in the form of masks, food, medicines, and antiseptics to the most vulnerable groups, the elderly, families, and people with disabilities. In remote communities where transport is difficult, we have created volunteer groups of activists. It would not be possible to solve the most urgent problems without their participation. The beneficiaries now have hope and the opportunity to improve their living conditions. Our projects have begun to achieve results, although it's too early to speak about sustainable results, which require more work. The support we have received for our work at this time was short-term, for 4 months, and therefore we are asking international organizations, embassies, and governments to maintain the only crisis center in the Kulyab region. And Kurbongul also pays enormous tribute to people who help others. She says she bows before them. Now I'm going to turn to our third speaker, Anastasiia Stytsenko. Anastasiia is from Youth Volunteer Organization Leadership in Karakol in Kyrgyzstan. Their aim is to involve young people in the process of building and developing civil society by training young volunteers and working with them on a variety of programs. Anastasiia.
Thank you very much. It is my great pleasure to welcome you all on the platform where we can exchange experiences and the concerns that have become particularly relevant this year because of the pandemic. Our organization has been working to build young people's capacity and promote volunteering for 15 years. Our target audience is about young people. This year, like many of you, I'm sure, we have faced numerous challenges as our well-established practices have ceased to be effective in the new environment of quarantine restrictions and transfer of our activities into online formats. So we have made certain conclusions, and we have introduced 3 transformations that have changed our mode of operation and interaction with our target audience. These 3 transformations include, first of all, improved coordination amongst CSOs, civil society organizations. Why has it happened so? I should say that many organizations failed to coordinate their activities. Each seemed to be working with their respective target audiences. Businesses and government agencies also lacked coordination. And whereas earlier we could afford doing this, we, during the pandemic, understood that we had to come together to support those who suffered from the disease. So this showed that thanks to better coordination, better collaboration, we can achieve tangible results. We have established coordination center, and it wasn't only our initiative, it was the initiative of young people who were active in the city. This coordination center helped us to create a database of people in need and that of aid providers. So each target group could get assistance from the government agency or the donors. At the same time, we received a lot of humanitarian assistance from other countries, major donors from the Kyrgyz diasporas abroad, and the population of our country itself. So volunteerism started to be very popular, and those who used to be volunteers, activists, entrepreneurs also wanted to participate in caregiving and in help giving. Thanks to that, we achieved very good results in our city. The major component that I need to note is that the population started to show civic activity, and which is unprecedented not only in Kyrgyzstan, but in other Central Asia countries as well. Usually people perceive themselves as objects of activities rather than subjects thereof. So I can hardly recollect other times when people would be so eager to become volunteers and rally round in an emergency. So we could see that the civil society is vibrant, and local governments actually learned from us. They saw that digitalization is the practice and solution that can be used today. All of that brought us to conclude that monitoring is possible. So I can say that pandemic, or rather response to it, united us. Our people's active engagement was of great help. Various structures, institutions, and organizations got to coordinate their work better, and various population groups got acquainted with new digital formats. The second transformation is about interactive tools, open source intelligence gathering and visualizations. Some countries might accept it and take it for granted, but it is totally new for our society. The spring lockdown in Kyrgyzstan lasted almost 2 months, from March to May, and as a result, many families lost their income. Initiative groups, volunteers, activists started to come together and to look for certain solutions. People were required to stay at home because of the lockdown. They had only 3 reasons to leave their home: either to go to grocery stores, to pharmacies to buy medicines, or to hospitals if their health worsened. So we collected information about people who needed. Next slide, please. Can we? Now you will see the interactive map that we developed. Okay, we collected information about people in need and about those who could provide this need. And we mapped all the data on the interactive map. It shows in different colors various types of assistance and support provided. So it was about counseling, legal aid, psychological counseling, food packages, medicines, PPE, etc. So not only did we deliver this assistance to individuals, but also to medical institutions, to hospitals. And here we can see which areas get assistance and what groups of the population get assistance. We collected and visualized these data, which enables experts and decision makers to assess the socioeconomic situation in a particular area. Moreover, such data allow running a comparative analysis in the database of low-income families, comparing the amount of needed and granted humanitarian aid, and improving the interaction of different actors. The map can also be useful for local authorities, NGOs, and the media when making decisions on managing assistance in case of a possible new lockdown or emergency situations in the country. So visualization of data allow us to improve our performance and to target certain issues, identifying the needs of the population. The third transformation is about digital internet resources. Thanks to this component of our activities, we could continue operating as a youth organization. We decided to go online to limit physical contact. People had to stay at home, but we continued operating. Like schools or universities, we had to adjust to these new changes and to revise the way we work. Many organizations decided to introduce certain distance learning methodologies. So we also adjusted our methodologies. The transition to distance learning made it possible to cut some events-related costs, not only financial costs, but also costs time-wise. We do not have to travel now. We do not spend time to travel. So we can work online. We can attend online meetings from home. This format enables us to invite more participants and engage larger audiences than during offline events. To our organization, this has become an innovative approach that opens up new opportunities not only for our team's operation, but also for cooperation with new partners and reaching out to our target group. I should also mention disadvantages of working online. Even though it is almost universally accessible and a good temporary solution, online work doesn't always work well in team building. It cannot replace live face-to-face communication. For example, physical interaction as part of team building activities is impossible online. But without it, without feeling physical contact and really doing rather than discussing something together, one cannot develop our true team spirit. In any case, thanks to digital formats, we do not stay idle. We continue our activities, for example, through online training. Thus, we were able to host a volunteering school last summer because it is a very topical issue, not only to teenagers and children who we target as our audience, but also adult volunteers. They are interested in types of volunteering work, and now they start engaging as well. Before, we could not imagine organizing an online meeting with a famous consultant or training without necessarily bringing them to our city from other countries or from the capital city to share their expertise. But now it has become a reality, and now our teenagers and our participants can meet them, albeit online. And to end, I would like to say that at this stage of our work, it seems possible to identify certain strengths and weaknesses, not only in our team's work, but also in the work of all activists, city volunteers, NGOs, municipal structures, and the government in general. I would like to commend our countrymen and countrywomen for their empathy and kindness that we witness every day when residents of our towns and villages take care of other people, become volunteers, and deliver humanitarian aid, support their neighbors and acquaintances. This is a new challenge to everyone, and the current situation in the world urges us to realize yet again how important it is to work together in good coordination, not only with our own team, but also with the general public, with the government, and to persist in our belief that even a small group of proactive and caring citizens is able to change the world for the better. Thank you.
Thank you very much. Thank you, Anastasiia. Excellent presentation and lots of very interesting ideas there for discussion. So I'm turning now to our fourth speaker, Birodar Mirzaev, from the Center for the Support of Civic Initiatives in Fergana in Uzbekistan. This center supports women with legal and psychological services and also business advice. So Birodar, over to you.
Здравствуйте, уважаемые участники вебинара.
Good afternoon, dear participants. Before I launch the presentation, I would like to say that we are just a branch of an entire network of organizations that operate in 6 regions, and I represent one of the most densely populated regions of Uzbekistan, Fergana and Fergana Valley. We've got more than 33% of the 32 million strong population of our country. We have lots of various social challenges and initiatives to respond to them. I will tell you what we do and what we've managed to achieve over the time of the pandemic. Luisa, can we show the presentation, please? Our center works with women. Speaking about what we do and what activities we engage in, I would say that we work directly with women, but this year we had to switch to working with institutions and agencies that also provide services to women. And our task is to empower women through promoting equal gender rights and opportunities in every sphere. Last year, on the 2nd of September, Uzbekistan, for the first time ever, adopted a new act on equal opportunities of women and men. Our next main activity area is raising public awareness of gender equality and all types of gender-based violence, since it is a true challenge in our country. In addition, we develop an effective system of preventing, protecting, and supporting crisis-affected women. And another important area of our activities is building capacity and providing assistance to partner organizations in promoting key principles and provisions of the CEDAW Convention and Convention on the Rights of the Child, its implementation into the national legislation and into our everyday life. Next slide, please. Now, speaking about our modes of operation during the pandemic, I would say that we had to focus on 3 major areas. Even though in 2019 we had 8 key areas of activities. So the 3 current key activities are as follows. Engaging with the target group. We work with women in crisis situations. They can come to our office, get legal aid, get psychological counseling, vocational training, and retraining courses if they wanted to start their economic activities from scratch but couldn't afford it. This year we had to transform our activities because of the pandemic. In March, lockdown was announced in our country. Very tough restrictions were introduced, and we transferred most of our activities online. Click it again. Okay. So what did we do? We provided legal aid. We had a hotline and a Telegram channel through which we could consult the women on their legal issues. Likewise, we organize psychological counseling. If women applied to us, we would refer them to our volunteer psychologists, and they could provide support to ensure certain psychological or mental peace and balance. We used to have certain vocational training courses. We trained women again in needlework, but since this option is not available to us now, and we couldn't offer those trainings to our target audience, we organized a course of modeling what they can do online. so that they can learn how to actually do things, but then try their hand at their homes. As I said, we launched the hotline. It was organized on the basis of our Republican Center, the central office, supported by UNDP and OECE. Since we are a branch, we now launched our own hotline. And we can trace where the consultative assistance was needed. Now, our next focus was on cooperation with partner organizations. Why with partner organizations? Like in the law on guarantees of equal rights and opportunities of men and women in Ukraine, on the 2nd of September, our parliament also adopted an act on protecting women against harassment and violence. It is not limited only with domestic violence, but it speaks about various types of violence and various types of social relations, labor relations, family relations, etc. Once that law was, or that act was adopted, several crisis centers were established across the country. But experts of those rehabilitation or crisis centers do not always know how to cater to the needs of those women. So we helped those rehabilitation centers with developing their skills of responding to applications, responding to women who come for help. Besides, since the entire team was under lockdown, we developed procedures for interagency coordination of those centers, so that we understand that when women apply to those centers, the centers would have to refer them to different public institutions. And since that mechanism wasn't described in detail in the act, in the law, we supported the government and in developing such procedures, and thus introduced the referral mechanism. When women came to us, we could refer them to other stakeholders or to other institutions that would be providing such assistance. We also monitor those applications and see whether the referral mechanism works. Our third focus was on working with the legislative framework, improving that legislative framework. We contributed to drafting of the new code on NGOs in Uzbekistan. We also analyzed the implementation of the Social Partnership Act and Civic Monitoring Act, conducted kind of a post-legislative scrutiny to see whether they were performing actively. And we also arranged online conference on implementation of the legislation. Next slide, please. Next slide is just about the pictures illustrating the activities that we held. The first picture is about our working group of drafters of procedures for interagency cooperation and coordination. Here you can see women on the training course. We've also got certain trainings and workshops for partner organizations, counseling, working with the young people. We are now starting to actively participate in 16 Days Against Violence initiative, and we are planning to organize a contest for younger people. Next slide, please. It will show you the some statistics about our results and outcomes, whereas in 2019, over the entire year, we received 877 applications. When we actually collected statistics for the previous 3 quarters, you will see that we provided assistance to 1,380 women. And here you can see in the purple online consultations, and in green face-to-face consultations. And you can see this jump, this spike in online counseling. We introduced digital technologies fruitful, and I would like to thank BEARR Trust for responding to our application. So you can see various types of services here, psychological counseling. And if we do not count applications or calls to the hotline, you can see that legal aid was in demand this year, because during the pandemic, we also observed, unfortunately, the pandemic of domestic violence, a spike in cases of domestic violence. As a result, we had to provide psychological counseling to women, and we also had to force the perpetrators to stop such practices. So our lawyers and attorneys also worked to enforce the law so that they would issue protective orders to these women so that they would be separated from the abusers. And this year, the figure is important. We got only 97 applications requesting business counseling. Last year, it was much higher. I mean, the figure was much larger. One of the reasons is that SMEs have faced difficulties during pandemic. Some of them had to close shop, and business counseling is not in demand this year, because you understand that you provide certain business consultations, you provide them with certain business skills, but then they will have difficulty implementing them in practice under the pandemic. Nonetheless, 97 women requested such consultations, and we provided them. It was about mini loans from banks, about various credit lines in the banks, etc. So within those business consultations, we also taught them to write business plans. So we learned about BEARR Trust earlier this year, and we applied for their small grant. It was accepted, for which we are extremely thankful. And now in November, we've started to implement this project. This is the project called Improving the Framework for Services Provision to Domestic Violence Victims. So this project aims to improve the quality of services provided by centers for victims of domestic violence, these rehabilitation centers, through enhancing coordination amongst various agencies within the domestic violence prevention system, with the governmental services that should be engaged in the referral mechanisms, and that's about public health institutions, law enforcement institutions, and educational institutions. Now we are at the stage of developing training modules and social advertisements for this project. So we will design 6 various leaflets to prevent domestic violence and to raise awareness about domestic violence. And all of the activities will be divided into 3 large groups. So we hope to hold 6 zonal trainings. I agree, Anastasiia, in that nothing can compare with live face-to-face communication, but still, if it is impossible, then we will hold online trainings for women activists, elected officials, and rehabilitation center experts, law enforcement officers, public health officials, educators, and mass media representatives, for them to avoid stigmatizing our target groups when they actually cover these incidents in the mass media or on their websites. We observe that a lot of mass media and bloggers often speak about certain incidents of domestic violence, but they would not cover them correctly, and they would not actually trace it to some advocacy work, and do not trace it to the prosecution of the perpetrators and the final outcome of the situation or of the incident. So we want them to be more professional in covering those trends correctly. That is extremely important. I'm telling you that because till last year, we used old terminology. For 25 years, we didn't even have the notion of domestic violence in our legislation. This term was not used by either public servants or the civil society institutions. They were speaking about some offenses in the families, but now we've introduced the terminology. Then we are planning to conduct a mini survey to learn about attitudes to domestic violence amongst experts of various civil services in different institutions and at different levels of government. Just top leaders or top officials and their subordinates. When in 2019 we participated in a survey related to the reconciliation commissions, and we asked questions about the efficiency of those commissions. We recommended that those commissions should cease to exist because members of those commissions did not discriminate between the domestic violence actually incidents and some quarrels in families. So we want to conduct this mini survey to see what the situation is about today, whether the decision makers really understand the essence of this crime, the essence of the notion of domestic violence. The next group of our activities will be related to producing social advertising materials on countering domestic violence. We will be developing leaflets, posters. We are planning to actually engage Fergana TV channel to develop some infomercial. And the third block of our activities, this is a poster that has been developed by our volunteers, just a sample of the materials that we are going to distribute. It will be targeting various audiences just to change public attitudes. Thank you very much. Should you have any questions, I'll be glad to answer them.
Thank you. Thank you very much, Birodar. And thank you to all of our speakers for really excellent and stimulating presentations.